Let's talk about cancer and alcohol. Alcohol is a carcinogen. Tell us more about that.
Well, there's lots of research showing that alcohol is a carcinogen, and there's really not very many good reasons to ingest alcohol if you're into health. And so, people have to balance their social needs and their lifestyle with their cancer risk. So I ask all of my patients during their treatment to absolutely give up alcohol during that time because I really want patients to be optimized to have a good outcome from their treatment. Who wants to go through that again? And so I feel very strongly about that. And then, after people finish their treatment, they have fear of recurrence. And so that's a teaching moment as well to remind them that if they want to take control of their future, they want to take control of the trajectory of their cancer risk, that is an important thing to consider. So, you want to have a glass of champagne at New Year's? Fine. But don't have a glass of wine or a cocktail every night if you have cancer risk. It will increase your risk, guaranteed.
Yeah. I don't drink anymore.
Yeah.
Almost 3.5 years now.
Yeah. Yeah.
Okay, some questions that we ask every guest on
Okay.
Conversations for Health. What is your favorite supplements? Not for your patients, but your favorites.
Well, my first love is botanical medicine and also Chinese mushrooms. So I always take Chinese mushrooms every single day.
Beautiful.
Yeah.
And what are your top health practices for your personal health and well-being, especially because you're always taking care of other people?
Yes. Well, when you are in patient care, you have to have good boundaries. That's a really good self-care habit. But for myself, I'm a lifelong meditator. I've been meditating over 50 years. So
Wow.
that's a piece for me. Getting enough sleep. I'm really disciplined about my sleep and exercise and being outside, being in nature. That's my medicine. I hike almost every day and I'm a gardener. So those are the things that I do to keep myself really robustly healthy.
I love it. That's beautiful.
Yeah.
And what is something that you've changed your mind about through all your years of practice?
Well, recently I changed my mind about how much protein that cancer patients should ingest.
Oh,
There's been the thinking has been that too much protein drives cancer. And that's actually recently been refuted. And I'm actually happy to know that because cancer patients have a high risk of sarcopenia, loss of muscle mass. And so that's part of aging physiology as well. And so protecting muscle mass is really important. You have to, as you age, you actually need more protein. But as you age, you actually have more cancer risk. So I was always conflicted about that. And now I don't have to be.
I didn't know that.
Yeah,
That's
I just
great
learned that
information to
recently.
know.
Yeah, yeah,
Thank you for sharing.
yeah.
So, thank you so much, Nalini, for joining us today. It's been a real pleasure interviewing you, and I learned so much. And I just appreciate all the work that you do in this field and have been doing for a long time.
Thank you so much.
Thank you.